Hello, I'm Dr. Michael Lenz, a pediatrician, internist, clinical lipidologist, and lifestyle medicine physician, and author and host of the book and podcast Conquering Your Fibromyalgia, where we take a holistic approach to understanding these chronic overlapping pain syndromes. Today on this video, we'll look back in time, 1989, when Dorothy from the Golden Girls comedy drama shares her battle and journey with fibromyalgia. Although this is fictional, we can learn a lot from chronic fatigue syndrome and how, even though so much time has lapsed in between, much of that still resonates, but we'll also highlight what we've learned since then. So let's get started. Also, stay tuned until the end of this episode to hear the backstory of how chronic fatigue syndrome got into 2 episodes of The Golden Girls.
Dorothy? I don't know what to do. I just don't know. I was in front of the class and I couldn't talk. I was too tired to talk. Not that they would have listened. They were too busy sniffing the whiteout they'd stolen from typing class. I had to excuse them early. I just cannot get rid of this flu. And it keeps getting worse, not better.
But it's been months now. Maybe it's not the flu. Flu doesn't last that long.
You ought to go back to Dr. Raymond.
I did, Blanche. He said I'm fine.
Get a second opinion.
She did. She went to Dr. Schlesinger.
Well, then, you are fine. Now, you want to hear my idea?
She is not fine, Blanche. Look at her.
I didn't say she looks fine. I said she was fine. She looks like hell.
Get her, Dorothy. You've got to see another doctor. Raymond is not a specialist.
Yeah, but what kind of specialist do I need?
Well, just call up Dr. Raymond and ask him. He'll refer you.
You have to, honey. You're getting sicker and...
Right away, we hear Dorothy describing something really important. She's not just tired, she's too tired to even talk in front of her class. Chronic fatigue syndrome and fibromyalgia isn't just about being sleepy or worn out. It's about a profound exhaustion that makes even basic tasks often very difficult, especially for those who are struggling with very high levels of symptoms. She also shares that she feels like she has the flu, but it's been going on for months. That's another classic feature we see. Many patients describe their illness as starting after a viral infection, but unlike the flu, it just never goes away. And notice how quickly her friends start trying to solve it. Go back to the doctor, get another opinion. That's what so many patients hear when they're told their tests are fine, even though their bodies clearly aren't fine. She even says she looks fine, and that's part of the challenge. Illnesses don't always show on the outside, but the suffering is very real.
Look, all I can think about are my test results and how to keep my gown closed.
You won't be needing it. Dorothy, get dressed. You're fine.
I beg your pardon?
We've run every test known to man. They're all normal. You can get dressed, go home, enjoy your life.
This reminds me of my 3rd podcast episode entitled, It's Not My Thyroid. In that episode, I talk about a patient who came in, and the first thing she said is, it's not my thyroid. She had been to doctors for years, and they would order tests, including their thyroid. And then a few days later, when the tests would come back, they'd say, okay, your results are fine. Leave your comments below if that's happened to you, and let me know how you felt when doctors would order these tests and they say they're all normal.
But Dr. Stevens, I was always healthy, and then I came down with this flu. I can't get rid of it. I've been sick for 5 months now. I have a constant sore throat, swollen glands, fevers. My muscles ache and are weak. I am totally exhausted all the time.
I know. You told me.
Well, maybe it bears repeating.
Look, Dorothy, can I ask you a personal question?
Yes?
You're divorced.
Yes.
How's your social life? Do you see men?
What in the world does seeing men have to do with anything?
For Dorothy and the Davids out in the world living with fibromyalgia, it's really important to recognize the impact of personal stress. And when you look at going through a divorce, that alone could be equivalent of catching COVID or some other severe viral illness in initiating and causing persistence of symptoms. It's good that the doctor took some time to explore other possible factors that could be contributing to the symptoms, even though back then This doctor, as we'll see, doesn't understand chronic fatigue syndrome and fibromyalgia with our more modern understanding. During that time, psychosomatic would have been used. That's a sense to say this is an imagine or it's all in your head. Unfortunately, I still see that more from the psychiatric world where I have patients who have fibromyalgia and chronic pain syndromes. And then I look at the diagnoses that the psychiatrist has used. And on the chart, the diagnosis will be, and as Dr. Joel Young shared in the interview that you can look at earlier this year on chronic fatigue syndrome, one of the most common diagnoses, if not the most common diagnosis they see in the psychiatric clinic is chronic fatigue syndrome, which in my opinion and many others is the same as fibromyalgia.
Oh, Dorothy, we know for a fact that if people are not happy, and lonely people aren't, they get all kinds of symptoms. Depression, fatigue, symptoms very much like the ones you described.
Look, Dr. Stevens, I don't think you understand, so I'm going to tell you again. I am at a point now where I am so exhausted that sometimes I cannot speak. Literally, cannot speak.
And that's important because many people who are struggling with fibromyalgia and chronic fatigue syndrome and other related syndromes often have unrecognized, often are neurodivergent, autistic, or ADHD. And rarely has this been recognized, especially in somebody who's an adult, especially somebody Dorothy's age, who would have at least average to above average IQ.
There are days when I can't get out of bed. Raising my arms to wash my hair in the shower is too exhausting for me. I can't even do that. I have heart palpitations. I can't concentrate. I forget things. I get confused.
It's not uncommon for patients who have nociplastic pain syndromes, chronic fatigue, fibromyalgia, to have been to the emergency room many times with palpitations. They'll do a workup that's often thousands of dollars, including stress tests, and the labs come back normal. The tests come back normal, and they're left with saying, hey, you're fine, nothing to worry about. Also recognize that what she's talking about is that brain fog as well.
Look, Dorothy, I don't believe you're sick, but you do. Now, you want to pursue this? You want to spend more money? That's fine with me. So, go to New York and see the man I studied with. He's the best neurologist there is. I don't know anyone better. If you have anything at all, he'll find it.
This scene is a powerful example of what many patients with chronic fatigue syndrome and fibromyalgia too often face. Dorothy describes symptoms of sore throat, swollen glands, low-grade fevers, muscle aches, exhaustion, so fierce she can't wash her hair or even speak at times. For many patients, it can feel like they have swollen lymph nodes in their neck, and sometimes they do, but often there's a lot of tenderness along the neck muscles in areas that are much more sensitive, also known as trigger points, which historically in the past were used for diagnosing but no longer are needed. And often these areas may be more sensitive during fibromyalgia and chronic fatigue syndrome flare-ups. These all are hallmarks of what we now understand as nociplastic pain syndromes, conditions where the central nervous system becomes hypersensitive, amplifying pain along with symptoms of fatigue and other body signals. Now, instead of acknowledging what we don't know, the doctor just says, your tests are fine. That's dismissive, but it also misses the bigger picture. Medicine has learned that a lot of these conditions, like chronic fatigue syndrome and fibromyalgia, are closely related, and most experts even now consider them synonymous. These are biologically based illnesses, even if they don't show up on routine blood work. And then the doctor shifts the focus to Dorothy's personal life, asking about her relationships and whether loneliness might be driving her symptoms. Now, in fairness, it is good medical practice to look just beyond the biomedical model and take what we call a biopsychosocial, spiritual, environmental approach. Asking about stressors, relationships, mood, and overall circumstances can provide important context because stress does have a profound impact on health. But the problem here is how it's done. Instead of integrating Dorothy's personal life into a broader, compassionate evaluation, the doctor uses it to dismiss her very real physical symptoms. The danger is that we can miss the whole picture. These chronic pain conditions are best understood within the broader framework. When we acknowledge the complexity, we move away from dismissal and towards truly holistic care. I really appreciate Sophie's fierce defense here. My daughter's not mental, she says. Families often have to validate what the medical system refuses to see. What we know is that these conditions involve changes in how the brain and body process signals. Recognizing that framework helps us move away from dismissal and towards a more compassionate, evidence-based care.
Rose gets to go.
Blanche, whenever I don't feel well, Rose makes me feel okay.
What is she, your best friend?
Rose knows I'm sick.
Well, I know you're sick. God knows you tell me all the time. What a waste. Rose Island in New York.
It's gonna be a great trip.
So, what are you doing here? You've seen everybody, nobody found anything wrong with you. And between their workups and mine, there are no more tests to run.
Yeah, but I know
Look, Mrs.
how
Borna, your main complaint is you're tired. I get tired, too. It's called getting old.
Dr. Budd, that's not what this is. I am sick. I've had to give up my job because I was too tired to do it.
How'd you get here?
I flew.
No, to my office.
A taxi.
And from the taxi?
But how did I get from the taxi to your office?
Not a hard question.
I walked.
Right, you walked. You're not sick, Dorothy. The people I see can't walk. They can't swallow. Some of them can't breathe. Look, don't take this the wrong way, but have you ever thought about seeing a psychiatrist?
I have seen two. Here are their letters. They both say there is nothing psychologically wrong with me. They believe it is physical.
What the hell do they know? Psychiatry is not a science.
Then why did you suggest I see one?
Because what you have is not scientific. What else was I going to do? Send you to New Mexico to a shaman? There's nothing wrong with you, Dorothy, except what happens to all of us. In case you haven't noticed, you're not 30. Take a cruise, Dorothy. Go to a hypnotist. Change your hair color. My wife became a blonde. She's a new woman.
This scene is heartbreaking, but unfortunately very true to life for people with chronic fatigue syndrome and fibromyalgia. Dorothy is trying to explain how her symptoms has forced her to give up her job. Something huge that shows this isn't just ordinary tiredness, yet Dr. Budd trivializes it, saying, "You're just getting old," and even equates her fatigue to his own everyday tiredness. That's a classic example of minimizing the patient's lived experience. Then the doctor falls into another trap, comparing Dorothy to patients who are visibly sicker, who can't walk or breathe. This is a very narrow biomedical mindset. Unless the disease produces clear, measurable dysfunction, it isn't taken seriously. But that ignores conditions like these nociplastic pain syndromes, where the nervous system is dysregulated and the symptoms are profound, even if the labs and imaging look normal. Now, in fairness, it is good medicine to ask about mental health, to explore the psychological and social dimensions of illness. Stress, mood, and relationships all influence health and deserve attention. Instead of weaving Dorothy's whole person context into understanding her illness, psychiatry is being used as a way to dismiss her suffering. And here's the irony. Even though the psychiatrist says she has no psychiatric illness, psychiatric research in the time since the 1990s is actually showing the opposite of what the doctor implies. We now know that ADHD occurs very commonly in those with chronic pain syndromes like fibromyalgia and chronic fatigue syndrome, in as many as 70 to 80% of patients. So rather than psychiatry ruling out a diagnosis, psychiatry has helped us recognize overlapping conditions that explain even more of the puzzle, like difficulties with concentration, memory, and executive function. And the final suggestions, take a cruise, change your hair color, be like my wife who became a blonde, highlight how disconnected this physician is from Dorothy's reality. Instead of seeing her as a whole person whose biology, psychology, social context, spirituality, and environment all matter, he reduces her down to superficial solutions. This is a powerful example of why patients with conditions like chronic fatigue syndrome and fibromyalgia often feel abandoned by the medical system. What's needed is not dismissal, but a compassionate, integrated approach that takes their suffering seriously and validates the complex biology behind it.
Gorilla.
Oh, Rose, that's not it.
What is it, Dorothy? What happened?
Maybe I am crazy. I mean, nobody believes me. Everybody thinks I'm crazy. Maybe I am. Maybe I'm really crazy.
Oh, Dorothy, you are not crazy. I mean, you are absolutely not crazy. I've seen the way you walk. I've seen how wiped out you get. You're not crazy, honey. You're sick.
I think so, too. I really do. But nobody believes me.
Doctors don't know everything, Dorothy.
You're right.
I mean, they think they do, but they don't.
You're right.
This scene is incredibly moving because it captures something almost every person with fibromyalgia and chronic fatigue syndrome has felt at some point. The fear that maybe it's all in their head. Dorothy is at her lowest. She's questioning her own reality because every doctor has dismissed her symptoms. That's what medical gaslighting does. It doesn't just deny the illness, it makes the patient doubt themselves. But then Rose steps in with exactly what Dorothy needs most: validation. Rose has seen her symptoms with her own eyes. How she walks, how exhausted she gets, and she tells her with compassion and certainty, "You are not crazy. You are sick." That's powerful. Sometimes the most healing thing isn't just a prescription or a test, but someone who truly believes you. This also points to something important in medicine. Doctors don't know everything. As Rose says, they may think they do, but they don't. Conditions like fibromyalgia and chronic fatigue syndrome don't show up on routine labs or scans. Just because we don't have a simple biomarker doesn't mean the illness isn't real. And here's the irony. It's also important to know that modern research has shown how real these conditions are. Through advanced testing and imaging, research has shown that up to 70 to 80% of people with fibromyalgia or chronic fatigue syndrome also meet the criteria for ADHD. That explains why symptoms like brain fog, trouble concentrating, and memory issues are so common. These aren't signs of being crazy, they're part of a well-described overlap in neurobiology. Dorothy's conversation with Rose is a reminder of what patients need. First and foremost is to be believed. Compassion, listening, and validation can go just so far, sometimes even farther than another test or referral. This is where medicine has the best chance to be truly healing.
How is she? Wiped out and depressed, even though she tries to hide it.
Sophia, she's gonna be okay, I know it.
She will be, Sophia. Now, she's tough.
You know, there are all sorts of things that people get that they can't diagnose, and then they disappear just as mysteriously as they came.
I think the worst thing in the world is if your child dies before you do.
Sophia, Dorothy is not going to die.
I know that.
She'll be fine.
I know.
Why do you do that, Rose? Why do you make up stories?
It wouldn't feel right to live anymore, you know? If a kid dies, it wouldn't feel fair to live.
Sophia, Dorothy's not dying.
How do you know, Rose?
I know.
Oh, now, honey, she's right. I know, too, and I'm a writer. I see things more clearly than the average person. My perceptions are keener.
Oh,
my
knock it
eyes
off, Blanche. Sophia, we have all seen our husbands die. We know what that is.
Except for her, she was getting a manicure. Pedicure.
Well, I'm 80-something, and I've seen more death and dying than any of you. Over the past 5 months, we've seen a perfectly healthy, energetic woman waste away. She can't do anything anymore. So what difference does it make that they don't have a name for it yet? It's still something. There were lots of diseases they didn't have a name for. You think they had a name for the Black Plague when one guy had it? Thousands had to die before they knew what it was. Dorothy could be dying, and they just don't know it.
This scene is so raw because it shows the helplessness that families feel when a loved one is sick, but doctors can't put a name to it. Sophia voices a real fear. What if Dorothy is dying and no one recognizes it? That fear comes from watching her daughter waste away over months, becoming a shadow of who she was. And she's right about one thing. Just because medicine doesn't have a label or test yet doesn't mean nothing is wrong. Historically, many conditions, from multiple sclerosis to lupus, were once dismissed as mysterious or even all in the patient's head before medical science caught up. Chronic fatigue syndrome and fibromyalgia fall into that same category. They are nociplastic pain syndromes rooted in how the nervous system processes pain, fatigue, and energy. We may not see them in an X-ray or blood test, but they are every bit as real and disabling. What's also important here is the range of coping strategies that women show. Rose tries to offer hope through optimism, Blanche through her writer's intuition, and Sophia through blunt honesty born of grief and experience. Each response reflects a way families try to manage uncertainty when medicine provides no clear answers. The tragedy, though, is that Dorothy feels caught in the middle, between a medical system that dismisses her and a family struggling to make sense of it. This is why doctors today need to go beyond the narrow biomedical model.
Well, as far as doctors go, you've certainly seen the best.
The best don't exist anymore. The best are dead.
Well, I don't know about that.
You're the exception, Harry. I didn't mean you. So do you think I'm crazy, too?
Dorothy, I think you're very sane. Just because a doctor hasn't found something doesn't mean there isn't something there.
Are you serious? Well, how come you know that and they don't?
First of all, dear, I know you. You're a stable person, and if you say you're sick, you probably are sick. Now, I want you to see Michael Chang. He's a virologist on staff here at the hospital. You know, there are all kinds of diseases we didn't know about before. Look at Lyme disease.
Harry, am I going to die?
I'm afraid so.
You really think so?
Sooner or later, I guarantee it. Unless, of course, the Japanese come up with something. Here you go. Come on, here's his name and number. My God, what hand...
This scene really hits on a pattern so many with fibromyalgia or chronic fatigue syndrome experience. Dorothy has already been to multiple doctors, endured endless tests, and still has no answers. Finally, she gets referred yet again, this time to an infectious disease specialist. On the surface, that might look like progress, but for patients, this often means months of waiting for a specialist appointment, only to have the specialist say, "This isn't my area," and bounce the patient right back to the primary care doctor. It's a frustrating cycle of delay where the person gets lost in the medical maze instead of receiving a real diagnosis and coordinated care. What's tragic is Dorothy's doctor actually validates her experience here. He says she's sane and likely sick, but then immediately shifts the responsibility elsewhere. This is the trap of purely biomedical model. If the blood work and scans don't show something obvious, the reflex is to hand off to another organ-specific specialist, hoping they'll have the answer. Again, this is where it's important to take a holistic approach, looking at the person, their symptoms, stress, function, relationships, and life context. And here's the irony. Dorothy is afraid she's dying, when in fact what she has is not a terminal illness, but a chronic misunderstood one. Without proper recognition, though, patients are left isolated, anxious, and fearing the worst. So this referral to another specialist isn't just a plot point. It's a powerful example of how patients can get stuck in limbo, waiting months and years for validation. What they need most is a doctor to listen, believe them, and guide them forward.
Oh, Dorothy, you look terrific. Where are you going?
Oh, to see that specialist that Harry recommended?
Wipe off your makeup.
What?
You look too healthy. Maybe that's why they don't believe you. You don't look sick.
If you're autistic and you're living with chronic pain, this definitely is something that you probably can relate to, because on the surface, you may not be expressing with your facial expressions and your body position and how you're acting and moving the amount of distress that you're going through.
She should go. They believe her.
You've seen some wonderful doctors, but I really can't agree with their findings. There are new diseases arising all the time, things that we don't necessarily have tests for. But that doesn't mean the diseases don't exist.
See how terrific.
Dr. Chang, please.
Well, I think that you are sick. I think you have something called chronic fatigue syndrome. It's fairly recent.
So he does go to a compassionate infectious disease doctor who's at least informed about the condition, chronic fatigue syndrome. He goes to order some more tests, which I'm not sure what he would have likely gotten outside of another repeat CBC panel, might have ordered an Epstein-Barr virus panel, although now we recognize, just like long COVID, there are many different viruses that can cause intense fatigue and exhaustion that can be a trigger for these nociceplastic pain syndromes. I've talked about that in many other episodes before. He also compares this to multiple sclerosis, where they didn't know much about it, and some people have some relapse, and some people are onto wheelchairs. I remember sharing with a patient many years ago that fibromyalgia is something that we can treat, that you can get better with, and that this isn't disabling in the sense of not being able to walk like somebody with multiple sclerosis. The next time I saw her, she came back from a trip to the Caribbean, and while there, she saw somebody sitting in the hotel resort looking at the ocean and was sitting in a wheelchair. And she made small talk with her and said, "By the way, what's wrong with you? I'm just curious if you don't mind me asking." And she said, "Well, I have fibromyalgia." And she came back to me and she said, "I thought you said fibromyalgia doesn't cause you to not be able to walk." And I said, "No, fibromyalgia does not impact peripheral nerves. It has to do with the central nervous system. She may have profound fatigue. She may have some underlying severe osteoarthritis and severe deconditioning where she's not walking, but that was a misunderstanding."
There are many theories about it, but most of us believe it's a virus. It just has not been identified yet.
Doctors just kept telling me I was depressed.
Well, depression can make a person feel tired, but depression doesn't start suddenly, give you swollen glands, sore throat, and all the other symptoms. Now, there are certain blood tests which we'll do, and if those results are abnormal, that combined with the exclusion of the other diseases will compose a profile that actually thousands of people fit.
So I really have something real.
I would say you most certainly do. But we should have our answers in a couple of weeks.
How long will it last? I mean, will it go away? Does it get worse? Does anyone die from it?
Well, no one has died from it. We don't know how long it lasts. Some people seem to recover in months, some still have it after 10 years. But that happens in other diseases as well. You take multiple sclerosis. Some people have 20-year remissions. Others wind up in wheelchairs.
We could just insert long COVID syndrome, and we would have the same kind of symptoms that Dorothy's experiencing.
There are variations. But all I can say at this point is try to adapt to it. Rest when you need to, eat well, eliminate stress if you can. Right now, there is no cure and no one thing that relieves symptoms in everyone. Right now, I'm afraid you'll just have to live with it.
Oh, why didn't they tell me, all those doctors I saw?
I'm sure some of them weren't familiar with it. And the ones who have heard about it sometimes have trouble believing it exists since they're not able to see it under their microscopes just yet.
Sadly, many people still feel the same about fibromyalgia.
Those colleagues of mine, unfortunately, tend to blame the victim.
I can't tell you what a relief this is.
I'm sure. Are there any other questions that I could answer for you?
Not now, not that I can think of. Maybe later. Right now, I can't even think straight.
Well, if there are no more questions, I'll order some blood work.
How did you feel when you got diagnosed with fibromyalgia or chronic fatigue syndrome? Was it a relief, or did you feel sad? Most of my patients, when they finally get the diagnosis and get the education and understanding, feel validated. And also they feel a little bit sad because they wish that they could have gotten this information much sooner. That's the purpose of this podcast and this YouTube channel, is to bring this important information to those who need it the most. If you enjoy this video or know someone who would enjoy it, whether that's a patient or a physician or clinician, please share it with them.
This is my treat. It is a celebration.
What are we celebrating?
My daughter found out she has a debilitating disease.
Ah.
And it has a name. I am thrilled.
We all are.
Well, of course. Congratulations. Champagne it is.
I can't tell you what a relief it is to just be sick, not sick and crazy, and to know what I have and that there are a lot of other people who have the same thing.
I don't like the name. I think I ought to have a better name.
Well, that's what Dr. Chang said. Chronic fatigue syndrome makes it sound like I'm just a tired person when it is so much more.
So what can we take from this? First, fibromyalgia and chronic fatigue syndrome are real, debilitating, often invisible on routine tests. And second, patients need to be heard and believed because the harm of being dismissed can compound their suffering. And finally, as Dorothy said so powerfully, medicine is not just about diagnosing, it's about compassion. So what's the backstory? How did chronic fatigue syndrome, that was relatively new back then in 1989, ever get into 2 episodes of The Golden Girls? Well, the answer is the storyline of this 2 episodes entitled Sick and Tired was deeply autobiographical in nature, as show creator Susan Harris recreated her own experiences trying to find treatments for a series of debilitating symptoms which a specialist eventually diagnosed as chronic fatigue syndrome. The script, which Harris later called A Way of Getting Back at All the Doctors Who Didn't Believe Me, offers a powerful example of the ways in which modern medicine perpetuates and normalizes outdated assumptions about nociplastic pain syndromes in both medical and popular culture. It wasn't until 1987 that the Center for Disease Control recognized and named the condition chronic fatigue syndrome. I hope you found this video not just validating, but also enlightening. Hope you've learned some, and also hope that you check out the other videos and podcast episodes. Hit the like and subscribe button. I'm Dr. Michael Lenz. Thanks for watching. Until next time.